Jessica Kavanagh.
Good afternoon, Chairman, Ranking Member, and members of the committee. Thank you so much for having me here today. And I'm grateful for the opportunity to speak on behalf of my late husband, Major Brian Kavanagh, our two young children, Marin and Evie, who are 7 and 5, and the millions of veterans and families who deserve access to the care and benefits. In addition, I'm pleased to be here to represent VetLinks.org and the many community-based organizations, particularly those in rural communities that support veterans trying to navigate the VA system and who need our advice and resources to get that help. Brian was diagnosed with post-traumatic stress in December of 2011. In May of 2014, we realized that he needed serious help for his post-traumatic stress and substance abuse. We went to our VA doctor and to our VA social worker, who both had no recommendations of where to send him for inpatient treatment. So I looked on the internet for scouring it hours and hours, and all I could find were places that were private for $30,000 to $50,000, nothing that we could afford, until I found a place locally here on the Washington Institute of Psychiatric Care, where I sent my husband, who was an infantry officer, to a psych unit for 2 weeks with 14 other women who were raped and sexually assaulted as children. Obviously, I knew that was not the right place to go, but we were desperate and needed to help. Fast forward to July of 2015, he was not getting any better. We were paying for private care at that point for a full year. And I called the VA, and they put him on a 6-week wait time for a mental health care appointment, which ironically fell on September 11th, 2015. We went and saw our social worker. We explained the situation again, how his substance abuse and post-traumatic stress was not getting any better. We were in dire need. He was not working at that point, and all she could offer was the psych unit at the Baltimore VA. I went home. We were both just very defeated, very frustrated with the system. Started making phone calls to VAs across the country to see what other specialized programs they had. Not one VA called me back. I was calling vet advocates until someone called me from Houston and said, "I've heard your story from multiple people. There's a VA committee hearing on October 7th, 2015. Secretary Bob McDonald at the time was going to be there. You should go." I went up and introduced myself to Mr. McDonald, and he helped me get him into the Martinsburg VA for a 90 inpatient unit. While Brian was there, he was coming across other veterans who weren't getting the benefits they were entitled to. That is where the idea of VetLinks.org was created, to help other veterans navigate through the system to get the help that they needed and deserved. When he was discharged, he was sent to a vet center that could help him with one trauma appointment once every 3 to 4 weeks. We went back to private care for Brian, paying for someone to help him twice a week, along with myself paying for care once a week. We were turned down for caregiver support multiple times. And then on June 28th of 2016, Brian ultimately lost his battle to post-traumatic stress. And it was then, during the eulogy, that I vowed to carry on his mission for VetLinks.org to help, even if it was just one family, to not have to live through the hell that we did. We were going to do it. So we started VetLinks.org, and now we help not just the veteran, but the caregiver and the family, and we get them the immediate help that they may need for post-traumatic stress, substance abuse, or TBI in an immediate fashion, and we pay for those services as well. We have partnered with Code of Support. They're a great organization as well locally, and with their peer navigators, we're able to help the veteran and the family members walk through the entire process from A to Z, whatever help they might need, and again, while paying for those services. So we still have a lot of work to do. I think we all have a lot of work to do. We're sending these men and women to war. They're doing their jobs, and we need to do ours to help them in an immediate fashion for mental health care. We all know there's still 20 suicides a day. We're not even counting the statistics for caregivers or children who are also committing suicide. So, as we've all sat here today, there's been one more family affected and now is going through pure hell, just like our family.
Thank you for your testimony. I'm sorry.